Toujeo is a new basal insulin that has been brought to the market. It has been described as a successor to Lantus. But of course what most people are interested in is it better than Lantus? Toujeo and Lantus use the exact same insulin molecule to treat diabetes. The difference between the two is that Toujeo is 3 times as concentrated as Lantus is. But on a milliliter per milliliter basis, they're completely identical right down to the inactive ingredients. So why would Toujeo be better than Lantus? Well, it isn't. In fact, what may surprise you is that Toujeo is actually much worse than Lantus is. If you open the package insert that comes with the box of Toujeo, right off the bat you'll see Toujeo has a lower glucose lowering effect than Lantus. And if you continue reading on, higher doses of Toujeo were required to achieve similar levels of glucose control compared to Lantus in clinical trials. Now that does not say better glucose controls, it says similar. So in order to get the same level of glucose control that Lantus provides, you would need to take much higher doses of Toujeo. And how much so? Well, we can continue reading and find out. Under Pharmacodynamics, it says that at a steady state, the 24-hour glucose lowering effect of Toujeo, 0.4 units per kilogram, was approximately 27% lower with a different distribution profile than that of an equivalent dose of Lantus. It also goes further on to state that in clinical trials, those taking Toujeo with type 1 diabetes after 6 months were found to be taking 17.5% more Toujeo than that of Lantus. But it's not only that you have to take more insulin to achieve the same results as Lantus, but if you take more insulin, you'll have more side effects due to the insulin. Insulin not only lowers blood glucose, but it has other effects throughout the body as well, and those effects you may not necessarily need or want. So if you have to take more of that particular type of insulin, in order to get the same results, you're going to get more of the side effects that you may not necessarily want or need. Another danger of this drug is that during a 6-month study of Toujeo, 44% of people with type 1 diabetes developed drug antibodies to Toujeo. And what drug antibodies are basically where the body vaccinates itself against a drug. And now it's not to say that this can't happen on Lantus, but the more of a drug you take, the higher of a chance that your body will develop immunity to it, where the body will develop specific molecules to target and destroy that drug. And it's a big reason why particular drugs stop working. People start taking very high doses of particular insulin, the body will actually start destroying the drug. And again, it's not to say that it can't happen on Lantus, but since you're taking more insulin to achieve the same results, the chances of that occurring are much higher. And as you saw in the study from the package insert, 44% of people after 6 months had developed this, where they did not have it before. So a quick recap. Toujeo offers no benefits compared to Lantus. It is in no way superior. But in order to get the same results as Lantus, you have to take more insulin. So you've got to take 17.5, about 20% more insulin. So every $5 you spend on insulin now, add another $1. So you've got to spend more money to get the same results with more side effects and potentially developing resistance to the drug at much higher rates than Lantus would be, because you take more of the drug. And the most disturbing part of it is that if you develop this resistance while on Toujeo, you can't just change back to Lantus because it's the same drug molecule. So you could potentially destroy the efficacy of the drug for both of them. Now this is where you need to be on your guard. You're going to hear all kinds of fantastical tales and nonsense from different doctors, different sites, advertisements, telling you things contrary to what I've told you. But all of the information that I got is from the package insert of a Toujeo box of pens. If you don't believe me and you take Toujeo, you can just open it and read it yourself. And everything I said you will find in here. This is not my opinion. It is what Sanofi says about their own drug. So you need to be cautious about people trying to give this to you. It is inferior in every way. There are absolutely no benefits whatsoever. All you're doing is paying more money to take on more risks and to potentially develop an immunity to the drug that works for you already. The people that are saying otherwise are people who are being paid for it. And it's just that simple. You need to be very cautious with those guys, because they are a bunch of snakes and they will sell your health out for $1. I hope you found this review helpful. If you have any questions, please leave them below. I'll get to them as expeditiously as possible. If you know anyone with diabetes, please share this video and hopefully it will save them some money and, more importantly, their good health. Thanks for watching, and I'll see you next time.